Good afternoon all. My name is Kamakshi and my topic is conjunctival autorotational flap in pterygium surgeries, a clinical study. No financial interest. Pterygium is a disease of ocular surface which is a wing-shaped growth of fibrovascular conjunctiva onto the cornea. It can grow either on nasal or temporal side of the limbus and it may involve one or both of the eyes. The size of the pterygium may vary from small atrophic, stationary or progressive in growth, and it distorts the corneal topography when extends onto the cornea and causes visual disturbance. The exact etiology is not known, but the evidence suggests that ultraviolet rays are the major contributing factors for the pterygium growth. Pathogenesis. Recent research studies points to the evidence of genetic component, growth factors, and extracellular matrix remodeling. And pterygium tends to occur in hot and dry climatic conditions, and high risk prevails in outdoor workers exposed to sunlight with setting of high reflective surfaces. Symptoms includes blurring, irritation, lacrimation, and foreign body sensation. The tractional force and the pooling of tears at the head of the pterygium can be leading cause of corneal flattening. Early surgical intervention can therefore reduce effects of corneal morbidity due to pterygium-induced corneal distortion and visual disturbance. Various surgical procedures available are Bayer-Sclera technique, amniotic membrane grafting, and artoconjunctival grafting. Bayer-Sclera technique is associated with high risk, and conjunctival grafting is associated with least recurrence. But artoconjunctival graft creates raw area superiorly. And conjunctival autorotational flap surgical method was first defined and described by Spaeth in 1926. The main objective is to evaluate the clinical outcome of autorotational conjunctival flap after primary pterygium excision. Inclusion criteria. All the subjects with primary pterygium, and exclusion criteria: recurrent pterygium, pseudopterygium, and anterior-posterior segment disorders. My study design is a prospective study conducted in ophthalmology department in GVP from April 2022 to April 2023. 25 patients are included who met the inclusive criteria. Visual acuity is assessed in all patients, and pterygium assessed under slit lamp and graded accordingly. Surgical procedure. Under local anesthesia, the conjunctiva of the fibrovascular tissue was resected, and the fibrovascular tissue under the flap is resected. Autoconjunctival flap was prepared as thin as possible. Then the conjunctival flap is rotated, nasal border towards limbus and limbal border towards the nasal side. Graft was sutured with a 10 nylon suture in 4 corners, and subconjunctival decadron and gentamicin were given. Pad and bandage was applied. This is a preoperative pterygium picture. And here the flap is being rotated, nasal towards limbus and limbus towards nasal border. This is a procedure where nick is given at the pterygium and undermining is done, and the pterygium is excised and flap is being rotated. This is intraoperative graft. This is another picture of intraoperative graft. And coming to the results, males were 12 and females were 13, and age distribution: 40 to 50 years were 10, 51 to 60 were 12, and more than 60 were 3. Bilateral was 40% and unilateral was 60%. The follow-up period was for 6 months, and recurrence is considered when fibrovascular growth had occurred at the site of previously excised pterygium crossing the limbus and extending onto the cornea. The recurrence rate of my study is 5.7%. The post-op findings: injection was in 14 eyes, retraction was in 7, granuloma was in 1 eye, edema in first week was in 7, and no significant findings were seen in 6 eyes. My present study recurrence rate is 5.7%, and compared with Mejia et al. Is 4.1%, Pulte et al. Is 2.7%, and Salmon and Mansour is 10%. This is a picture of post-operative graft day 1. My conclusion is, after surgery, the patients had a follow-up for 6 months and recurrence is 5.7%. Conjunctival autorotation flap is equal as superior conjunctival limbal graft and avoids raw area superiorly. It's useful in double-headed pterygium and also preserves superior conjunctiva for future uses. It's a useful technique in cases where it is not possible or desirable to use the superior conjunctiva as the donor source. These are some of my references. Thank you.
you are not using limbal epithelium. You're just conjunctive. After excising the pterygium, you're just
putting it nasal to the limbus,
maybe
limbus to the.
do you think recurrence rate is little high?
It is less
Maybe
than amniotic membrane graft, but equal to autoconjunctival graft. But it is used for, sometimes that superior raw area might be useful for other surgeries in later conditions in older patients, maybe who develop glaucoma for bleb and all. That superior conjunctiva may be useful. In such conditions, maybe my autorotational flap will be useful.